Hello, and welcome to this demonstration of the NextGen Ambient Assist tool designed to boost provider efficiency. Today, I'll be showing you how this powerful tool can seamlessly integrate into your clinical workflows, saving you time and significantly reducing cognitive load. Welcome to today's visit in NextGen Mobile, your gateway to seamless clinical documentation. This intuitive single screen streamlines your entire process. Effortlessly navigate the NextGen Ambient Assist workflow, engage in natural patient conversations, and watch as your visit note is seamlessly generated and initiated for you. Let's take a look at how Ambient Assist works in a typical consultation. Good morning. My name is Dr. Brooks. It's nice to meet you. What brings you in today?
Good morning. I've been having some difficulty breathing lately, especially when I'm active. It's been going on for a few weeks now, and I thought it would be a good idea to at least get it checked out.
Well, I certainly appreciate you coming in. Let's start by discussing your symptoms in a little bit more detail. Can you describe the nature of your difficulty breathing? Do you notice it during physical activity?
It's more noticeable when I'm active, like when I'm walking upstairs or doing some light exercise. I feel like I'm not getting enough air. Like sometimes I need to stop and catch my breath.
Okay, thanks for sharing that. Have you experienced any coughing?
Yes, I've had a bit of a persistent cough, especially in the mornings.
Okay, have you noticed any wheezing or chest pain?
No chest pain or wheezing that I've noticed.
All right, well, let's delve into your medical history a little bit. Do you have any pre-existing medical conditions or a family history of respiratory problems?
My family history doesn't include respiratory issues. I do have high blood pressure and I take a medication for that.
Okay, got it. In terms of lifestyle factors, do you smoke or have a history of smoking?
I used to smoke, but I quit about 5 years ago.
Okay, thanks for providing that information. That's great that you quit smoking. We're going to go ahead and move on to a physical examination. Given your history of smoking and the nature of your symptoms, I'd like to explore a few possibilities. With your history of smoking and respiratory symptoms, there may be underlying respiratory issues such as chronic obstructive pulmonary disease, or also known as COPD, or asthma. So we also need to rule out any infectious causes for your cough as well. Secondly, given your history of high blood pressure, we should also consider cardiovascular factors that might contribute to your symptoms. This may involve assessing your heart function and circulation. So really the plan for today is what I'd like to do is perform a diagnostic test to include a spirometry, which is a pulmonary function test to assess your lung function. This is really going to help us better understand if there's any obstruction or restriction in your airways. What we'll do is we'll get these tests ordered and schedule a follow-up appointment in 7 days to discuss the findings and determine the most appropriate course of action. In the meantime, I certainly recommend maintaining a healthy lifestyle, including regular exercise that you can tolerate, a balanced diet, and adherence to your blood pressure medication.
That sounds reasonable. What can I expect in terms of timing for these tests and how soon should we follow up?
I'll have my assistant go ahead and schedule the tests for you as soon as possible. And what I'll have you do is make a follow-up appointment with me to see me back in 7 days to sit down and review the results in detail.
Okay.
After selecting End Visit, experience our enhanced preview feature, presenting the AI-generated note on a single scrollable screen for swift review and effortless editing. Double tap on any section to seamlessly add additional documentation where necessary. Enjoy unparalleled flexibility and streamlined documentation without ever leaving your current screen. Thank you for choosing NextGen Mobile. Your personalized workflow awaits.